A very good morning. We thank you for staying with us on KTN Sunrise Live. It is an important day today, celebrating World Environmental Day, and also, hopefully by this evening, we will be celebrating a win by the Harambe Stars. We're asking you to send us in your messages regarding the team and your hopes for them. Jaconi Otene say, beating the African champs will show that our football has come of age. Kenya 2, Nigeria 1. Paula Cha, thank you. You say, our team has the ability to illuminate the world with their brilliance. All the best. Nation rallies behind them. Keep your tweets coming in and we will share them during the course of this show. And this is all about the national team. And speaking of national issues that plague the country, we want to take it in a different direction from now in our discussion on drug abuse in the country. Now, some of the things that are becoming commonplace really shouldn't be, like smoking weed or bang or cannabis as it is scientifically known. I think by now you know about the fact that weed cookies and weed cakes are served, at parties, and this is just becoming, it's becoming a little bit too ordinary, right? Something needs to be done about it, and NACADA is doing something about it, definitely. They have a second national annual conference that takes place next week. We're joined today by the CEO to discuss this and a lot more that's going on in the fight against drug abuse in the country. Dr. William Okedi, we thank you very much for joining us.
Thank you indeed.
So, let's talk about it. Do you find that some of these things are becoming a little acceptable, shall we say? It's cool that people drink and get drunk beyond, a point of control. It's cool that young people smoke bang, and is it becoming a little bit more commonplace now than before?
Thank you very much. I think the problem of alcohol and drugs really in our country has become a major issue, particularly among young people. Statistics that we have from a survey conducted last year really shows that young people in our country, as young as 4 years, are engaging in consumption of alcohol. Children,
4 years?
As young as 4 years.
Wow, that's terrible.
And the median age among young people between 15 and 25 years who are consuming alcohol is about 8 years, and that is a serious issue. If you look at the various drinks that young people engage in, about 12% of all young people in our country are consumers of alcohol. If you look at bang, or for that matter, about 2% of our young people are consuming this. And I think that there is now a trend which is an emerging trend in terms of consumption of drugs among young people. One is the phenomena of shisha, and that is about tobacco, which is a practice in the Arabian countries, which now in most of our urban areas you find young people engaged in. And what happens is that whereas it is tobacco, this shisha is then laced with some other hard drugs like cocaine, like heroin, which is a major concern. If you look at tobacco consumption among young people, it's about 6%. And I think these are worrying trends in our country. Our young people are heavily influenced into this, and there are a number of factors. One is, of course, peer pressure. A lot of them get this, especially those who are transiting from, say, primary or high schools into universities. There is, of course, the phenomenon of lack of role modeling. I think that across our country, there is a serious issue. And you can look at the various regions. If you look at Central Province, for example, we have a huge problem of alcohol consumption, to an extent that most of the households, about 60% of households in Central Province, are female-headed. What does that mean? It means that young children, particularly the boy child is growing without a role model.
Influence,
and
yes.
what he sees are parents and other role models who are just consuming alcohol.
So the cycle is perpetuated?
It's perpetuated.
Okay.
So these are serious matters.
All right. And when you talk about some of these statistics and these figures, what are the effects of the fact that we have, a sizable population of young people engaging in alcohol and drug abuse? How does that affect our society? How does that affect our economy in the long term? Because I think we seem to think, well, I'm just having a drink, and it's not as serious as it is. But what are the effects of this in the long term?
Obviously, I think the effects of excessive alcohol consumption and drug abuse amongst our young people is that this country is losing a very important generation. The potential that this country has in terms of economic development is reduced. If you look at some of the regions, for example, if you look at Eastern, where Miraa, which is also a huge challenge to young people, we have reduced enrollment in schools because young people go into cultivating Miraa and they are selling it. A study that has been done by UNESCO shows exactly what the impact is in terms of enrollment, in terms of broader socioeconomic development, and indeed increase in crime. I think the impact of alcoholism and indeed drug abuse in our country transcends through various sectors. If you look at the agriculture sector, areas that are, for example, tea growing, we are having a challenge. If you look at employment opportunities that come, for example, last year, if you look at Central Province and the army was recruiting young people to join the army, at 8 o'clock in the morning, when the recruitment teams went to recruit, young people were already down and drunk, went down to Malindi. Young people who are already addicted into drugs could not stand up to be counted. So I think, in summary, alcohol drug abuse has negative impact at the household level, at the community, where families are suffering. If you go to Mombasa, and we've been to Mombasa, and the cry of mothers whose children are now dependent on this. If you go to Central Province, it's the same story. Rift Valley, and we are encouraged because in some of these regions, and the county governments have taken this seriously. As you know, Coast Province has been declared, Coast, particularly Mombasa. Yes. The county governor declared this county disaster.
Yes, he did.
If you look at Elgeyo Marakwet, the county governor there as well has declared alcohol a county disaster. So I think that our call and the really aim of the conference that is coming up next week is to call on Kenyans to take action to protect our young people. Action by leaders, action by institutions of higher learning, action by the youth themselves, by deciding that this is not the way to go and does not assist this country.
Indeed. And we'll also shed more light on that and the stakeholders that are involved in that process. Now, with all the statistics and the facts and the figures and, what we know about drugs in this country, let's talk about some of the measures to fight drug abuse, perhaps to even fight the presence of drugs in the first place. Some of these measures that are being put in place by NACADA and other stakeholders to curb this vice.
Thank you. Just to clarify that NACADA is responsible, mandated by legislation to coordinate a national response to the challenge of alcohol and drug abuse in our country. And we have two strategies to deal with this. The first one is to try to reduce the demand for alcohol and drugs. And that really takes us to the province of information, awareness, and preventive measures. And towards this, NACADA, alongside many other partners, including public sector institutions, including higher education institutions and indeed community leadership, youth networks across the country, has been training what you would call peer educators, so that information education can reach out to the communities. We have also decentralized our services down to the regions so that we can be more responsive to the county governments in particular, because this is now a devolved function which the county governments have got to take through. We are also in the area of demand reduction, looking at how we can make services accessible to those affected addiction. And we do two things. One is to work with closely with the Ministry of Health to ensure that treatment and rehabilitation facilities are available in the country. And that also includes working more specifically with the faith-based organizations. Over the last few months, we have strengthened our relationships with the churches and religious institutions. For example, we now have a framework for collaboration with the Anglican Church in Kenya, which has, on the one hand, prevention issues, on the other, to explore how they can, through their institutions, improve on training in this area, and also to provide services in terms of treatment and rehabilitation facilities. We have done the same with the PCA Church. And these institutions, including the Catholic Church, have a large following and infrastructure that goes down to the communities. That is on the one hand. Specifically when it comes to the youth, with regard to demand reduction, we work closely with all the youth networks in the country. We strengthen them, we provide educational materials and so on. We also train facilitators in tertiary institutions, all the universities, and we have very specific relationships that we are developing with universities such as Moi University, Kenyatta University, and so on, so that this becomes an institutionalized strategy within those institutions. Beyond that, the other strategy that is important is the issue of supply suppression.
That's a big one.
With regard, and that's a big one.
That's a big one, yes.
And with regard to supply suppression, NACADA chairs a national technical committee of 16 different ministries that are involved in enforcement of the laws. But NACADA's particular role in this area is to ensure that we support policy. We also work with these institutions to look at the legislative framework, and we develop and working with the parliament various legislative bills that go to parliament. For example, we have the Alcoholic Control Act. We also have the Narcotics and Psychotropic Substances Act. These are areas that we work together. NACADA also facilitates that these institutions look at the various implementation of various policies and laws. And I think this is where we have a challenge. If today we really could implement all the laws, just the laws that we have, despite the shortcomings, we probably could deal a major blow to issues of alcohol and drug abuse. And over the last 2 months, as you may see, we have had our law enforcement agencies really take action to deal with importation of drugs.
Of drugs in the country, yes.
In the country.
Okay. Allow me to say, to ask, where do you think most of the drugs come from into the country?
Now, most of the drugs that come into this country come through the porous entry points, where we also have a challenge of staffing on the one hand. We have the, for example, the anti-narcotics police unit that are supposed to work with the KRA and the customs and others to man these various. These officials lack a number of equipment to ensure that they can detect the drugs. We have problems of even training of this staff, but the drugs come through, for example, cannabis or bangi. A lot of it is grown in Tanzania and finds its way from Tanzania to our markets. It goes the whole way to Mombasa. Of course, you are going to ask me, how does it travel the whole way?
All the way,
it
yes.
comes from Uganda and gets its way. And I think, like any other situation, within our context, we have challenges of integrity amongst law enforcement. And I'm sure this is an issue that is a national issue that we all have to deal with. And I think that is a major issue within the law enforcement.
All right. You'd also talked about the fact that rehab centers need to be more accessible. Dr. Rehab centers are fairly expensive, and we know most of them, are private owned. I think we have some government run, institutions, but the process itself of rehabilitation, is expensive, and perhaps for a lot of people that would like to, even within the institutions that are run by the government, rehab is not a cheap process. What can we do in terms of making some of these centers more available?
Thank you very much. I think I concur with you. That treatment and rehabilitation centers and access to them is a major bottleneck to dealing with this. And that's why, as NACADA and as government, our emphasis is on issues of prevention. Prevention from the family level to tertiary levels. And I think that as NACADA, what we have tried to do in order to access these services for those who require them. One is that we are constantly advocating with other government departments, including the Ministry of Health, to ensure that these services are available. Across the country, 98% of all the treatment and rehabilitation centers are owned by private individuals. Secondly, in order to make sure that these are accessible in the public service, we have worked with the Ministry of Health and with some international organizations like the United Nations Office on Crime and Drugs to support Mombasa Coast General Hospital to have renovate some of the buildings. Now we have about 2 units where treatment and rehabilitation facilities for men and women, and we have done the same at Moi Referral Hospital. And we have put, as NACADA, some seed money to make sure that that happens. Secondly, we have been advocating with health insurance companies to make sure that they see addiction as a disease. That addiction must be treated as a disease like any other.
Right.
And that people should be able to take insurance to access the services. And as NACADA, we have made a commitment as part of our strategy to put money in the county governments to ensure that people can access treatment and rehabilitation.
And of course that takes me to the next question, which you just touched on, and it's still the understanding of addiction in this country. I think for most people, when you're drinking, you're cast away in society, and do we still have that? Do we yet have that understanding in the country that addiction is a disease and is something that is treatable? Of course, they say once you're an addict for life, but then of course there's things that you put in place to make sure you don't fall back again. But do we yet have that understanding about addiction and how it works?
Yeah, I think understanding of addiction itself is a major challenge. Not only is it to the general population, but I think it also is an issue that needs to be understood even among health workers, because for a long time this is been stigmatized. There is stigma associated with it, to the family, to the individual, but people need to understand that among the causative factors that lead people to addiction are genetic factors, factors that you do not have control over.
So when you say that, there are some people who are predisposed to addiction as opposed to others because of their genes? That's what we're saying?
Yes.
Okay, all right.
And therefore, we need to ensure that our legislation, if you look at people who are addicts and they're rounded up, and you could see the example in various places, in Mombasa and other places, where people who are actually sick
are criminalized.
And incarcerated. So one of the programs that we want to put in place in the next financial year is to look at how we look at our legislation, how we work with our judiciaries and the legislative system to make sure that people who are sick are treated as such, and we work closely with the prisons service to see how those that are put in prison because of this can continue to access services.
Okay, yeah, very important, and I think such an important point that you've raised about not criminalizing it, and even for health insurance firms to understand that this is a disease and it can be treated, and to perhaps have that as an insurance policy. I think we're at that point now with addictions where we were with HIV and AIDS a couple of years ago, but now insurance companies are coming around, and perhaps with more of the efforts that you have, this is something that will definitely be included. Now, there are some controversial methods that come up for people to say, okay, let us help the addicts. I want to know your thoughts on that. For example, at the coast, there are organizations that say, okay, these are addicts, and while we go through the process of treatment, one of the things we want to do is give them free, clean needles that they can use to prevent other infections, so that we're not compounding the issue. I wonder what your thoughts are on some measures like these.
Now, I think science has shown us, and this is something that even our government has signed through the World Health Assembly, that in order to deal with addiction, there are a number of processes. There is a compendium of treatment that they require, from prevention to actually treatment. And in this country, the Ministry of Health, the National AIDS Control Council, the National, the NASCOP, together have developed a draft policy framework that will guide the administration of treatment for addicts. As of now, as far as I know, there are international scientific and conventions that the government has agreed, but the policy framework has not been put in place. A number of things that need to be done are known. Specifically, the issue of needles and syringe exchange program. These are programs that have been used elsewhere, and our neighbor Tanzania, countries like Mauritius and so on. And last year we had a whole conference that focused on this matter. And they have shown that in order to reduce particularly hepatitis as well as HIV among intravenous drug users, a program can be put in place to ensure that the needle exchange and the syringe exchange is organized in a way that it prevents. The aim is not just to indiscriminately distribute this, but to make sure that people are protected from transmitting. When these people are craving for the drug, they go to lengths where they share their own blood, and they share the same syringe. And this is really a serious issue in terms of transmission of those illnesses. So that the aim is to have this syringe and needle exchange program alongside education, alongside treatment, other medical techniques.
So it is part of the process. So it just doesn't start with giving them the syringes and walking away and, letting them use the drugs at their own discretion. It is part of the whole treatment compendium disease. Okay, of the disease. All right, fine. That is well understood, I think, from that particular point. Like you talked about in the beginning, NACADA coordinates these efforts. So it's not NACADA that does everything and says, okay, this is what we're going to do. And you work with various stakeholders. Let's talk about the conference that's coming up next week. Who's been invited and why you have chosen the people that you have for this conference.
Thank you very much. The conference next year brings...
Next week?
Next week.
Right. Okay.
Next week, on the 10th of on the 10th, brings together key players in the alcohol and drug abuse field. It brings researchers, brings our policymakers, brings academic institutions, brings international and national experts to deliberate on this matter. The aim is really to provide a forum for these stakeholders to share their experiences, and in particular to focus on the youth, because the theme is the youth and alcohol in Kenya, a call for action. So it aims at sharing new knowledge in research, looking at appropriate policies, best practice in implementation of these issues. And we are optimistic that our senior policy makers that we have invited will come to grace this period. We have called people so that together we can learn, we can share, and we can take action.
Okay. This is the second conference of its kind. Based on what happened last year and what's happening this year, let's talk about perhaps the shift in some of the learning lessons from the conference that was held last year that will inform this year's conference, and indeed, the general activities of NACADA over the next year or so.
Yes. Now, the conference this year has really drawn from the lessons of last year. Particular lesson is that we need to focus on the youth of this country, and therefore the theme was focusing on the youth. Secondly, last year the conference, in terms of participation, drew only about 700 people. And that was an encouragement because it was the first time. This year, we have actually gone to our aim for this year's conference is at least to have about 1,000 plus participants. And that has meant that we have also shifted the venue to a larger venue. We also are in particular aiming at getting the leadership of this country. We are happy as NACADA, I should say, that the leadership of this country, the current leadership of this Jubilee government, has demonstrated from different levels, right from the county level to the head of state. And I must register our appreciation to the head of state himself. He has taken a very bold stand. On his inauguration, he spoke about this issue. During the opening of Parliament, he spoke about it. And during his tour of Central Province, I listened and I watched him stopping in different places as he traveled back to Nairobi 13 times, emphasizing the issue of alcohol and drug abuse. So we are encouraged that the leadership and the time is right for us, and we are praying that he will be there for us to grace this occasion, and that it is time to mobilize everybody to really take action about alcohol.
Okay, at 13 times, that really means it's on his mind.
Yes.
And therefore, will do everything he can within his power to be able to assist this matter. There's some feedback that's coming in from our viewers, and this is one. I have my thoughts on it, but you are the expert this morning. And it's from Flexi. He says there's a big difference between abusing drugs and using. Really, Daktari? Can you ever really use drugs efficiently?
Agreed. But again, that there are people who use alcohol, but they are not dependent.
Right.
In our country, in Kenya, about 13% of the population uses alcohol. But when it comes to abusing it, that means there are people who can drink and drink and drink and they don't care.
Right.
Even though the drinking is harming them, they just are abusing it. Even when they don't need it,
they're using it. Okay.
So, and that is about 5.5% of our population is in their dependency.
Okay. That may work for alcohol. Can you say the same about the hard drugs like cocaine and heroin? That there are some people who are just recreational users, and I use cocaine once in a while, but I'm not addicted. I don't know. There's myths that we hear, Daktari, like about heroin, where you hear particularly for women, one hit and you're hooked. I don't know. Let's talk about the hard drugs and using and abusing.
Yeah, I think that one of the great dangers of all these drugs is that one leads to the other. You start taking alcohol, then you take miraa, then you move on to the next. But let me get back to the question you are asking. They are highly addictive drugs, cocaine, heroin, and so on. And that once you are in it, there you are hooked. And again, there is now global trend because, and this is, I think, a dangerous trend which for me and for us as NACADA are extremely concerned about. For example, the issue of cannabis. There are people, and most of the Northern Hemisphere, that is Europe and so on, there are groups that are now seriously campaigning for decriminalization of cannabis. There are also people who are saying we should not penalize people who are found, who are just users, who just smoke cannabis or cocaine for that matter, or users of heroin, because they are just users and it's for recreational purposes. There are, of course, those that believe that the people who should be penalized are the traffickers. And that is the current debate in this area. My own take, and for the sake of our country, is that at the moment you start, you are in it, and it becomes a pain to get out of it.
That's right.
And I think we have values, our family values, our national values, and we should guide against this to our young people and to the general population.
Indeed, indeed. And I think that's where we would leave it for now, and a very good way to end the discussion where you say, we have values, and that is what should be able to guide us. The conference takes place next week. Can you remind us of the dates again?
The conference takes place next week from 10th to the 13th.
Okay.
And the opening will be on the 10th.
Okay.
We have a number of themes that we'll be focusing on. We are looking at issues of alcohol preventive strategies for the youth. We are looking at issues of treatment, what facilities are there for the youth. We are sharing experiences on current research in the various dimensions. And we are also looking forward to getting policy direction from the highest policymakers in this country.
Indeed. And we wish you all the best with that, and we'll definitely be following up on that. Thank you very much, Dr. William Okedi, who's the CEO of NACADA, which is the National Authority for the Campaign Against Alcohol and Drug Abuse. Like we said, it's not about criminalizing those who find themselves addicted, but rather about getting them the right help. I just want to give you a number that you can use that would help you in that. Call 1192 now for help on drug and alcohol abuse. 1192. If you didn't get that, I'll be posting that on Twitter in just a moment. 1192 for alcohol and drug addiction. If you are one such person yourself, or if you do know somebody that is going through this, you'll be able to get the help that you require. That has been our discussion for now. But we want to bring you our feature, and that debuted last night, but that will come after the break. It's all about How Things Work by Betty Callow. She debuts the first episode of that. All of that after the break. We want to take a short break now, and I just want to take a quick look in the studio. Yes, he is here. Dennis Atumbi is in studio with us and will be joining us after the break. So do stay with us. You're watching KTN Sunrise Live.